I'm Leah Cook. I work for the Maine Department of Agriculture, Conservation, and Forestry. My day job is helming up the produce inspection team. So we do gap audits, FSMA inspections, and outreach, and commodity crop inspections. So come to it from a completely different lane than public health, but we have some experts on the line with us, so that's very helpful. We'll just introduce some of the participants tonight. So Lisa Tappert from the Maine Mobile Health Program is with us. Wave hello. Stephen McDermott is from the Maine Housing Authority. We've got Nancy McBrady, who's our Bureau Director for Agriculture, Foods, and Rural Resources. And if there's anybody else from our state partners who needs to be introduced, let's do that now. Is there anybody else we've got here? Okay, there's a lot of us working together these days, so I always want to check in on that. So thank you all for joining us. The purpose of having this call tonight is to talk about the state's interim guidance for COVID-19 for ag workers. We did one session on this initially. If you haven't had a chance to see that, I'm going to go ahead and share my screen, hopefully. We have a longer guidance that's up, as well as a short 2-page guidance that hits points. So our goal tonight is we just want to revisit a couple of those key points of the really important interventions to protect the migrant and seasonal worker health. We want to talk about some practical information of how does this play out on the farm if we're testing folks and we're finding cases. And we want to share some of the lessons that we've learned from mobilizing for the wild blueberry harvest, as well as some of the other incoming workers that Lisa's team has been working with already. So we want to share some of those lessons learned, and then we want to have an open discussion with you guys about upcoming apple harvests and any other next harvest for folks who are represented in the online room. We're pretty motivated at the state to try and get out in front of this and do whatever we can to minimize the spread. That's good for your business, it's good for the workers, it's good for our communities, and we have a shot at being a success story in Maine of not having it affect every single worker when there's one case. So if you have questions, just throw it in the chat. Feel free to chime in and ask as we go along. We're going to run through a bunch of information at the beginning and then hopefully leave some good time for discussion towards the end. All right, so we're going to sail right into it. So as I mentioned, there's this 2-page guidance that's just the really high level key points. Obviously, you want to make a plan if you can. We can't know everything ahead of time, but all those basic things you keep hearing about everywhere that we can increase our physical distance between workers, the better off we're going to be. If we can reduce the density so that we're not all bunched up, that's going to help. If we can increase our hygiene and sanitation for things like hand washing, maybe we need more portable hand washing stations, maybe we need to plan more time for breaks. Those are things that we want to drop in there. One of the things that we really recommend is if you can afford to do a quarantine on arrival, please do. The purpose of a quarantine is so that any positive cases can be detected in that time, because there's an incubation period after exposure before people may have symptoms or before they may actually be infected with it. So that gives you time for that to manifest itself. So that then we can detect it and isolate it. We know that's not always possible depending on what your incoming worker situation is, but again, that's the best practice if we can do it. It's worth mentioning that the Family First Coronavirus Response Act will cover the pay for workers during that initial quarantine, and there's additional guidance for that we can talk about later if you like. It's good to be really clear with folks about what those expectations are. The other thing that's very helpful is if you can do initial testing as people are coming in on arrival. That can really help to identify cases early on so that they can be isolated, so it's not spreading to every single worker in the shared housing. So if you can do that, again, that's really excellent. Maine Mobile Health Program can help provide some of that testing at no cost to the grower. So if you haven't already been talking to Lisa, you're going to hear me say a lot, talk to Lisa. They're definitely an excellent resource for a lot of what we need to do right now. And if you have someone who has symptoms, we're going to want to be testing at that point as well, which I hope is fairly obvious. For a couple of other of our key interventions, we want to be thinking about what our types of exposure are. So that can either be in household contact, that can be or closer than 6 feet with someone for 15 minutes or more while they're sick, or for up to 2 days before they start showing symptoms. And so that really drives this idea of, if we can't separate people on a household level, can we group the work or transport by household? So we're minimizing the risk of that spread. So we have units where we can have a break between any sort of spread. So that's something that you need to think about, the size of your crew, and think about if that's possible. Think about your work assignments. You might be able to use blocks of workers together from multiple households. And it's not to say you don't have to confine people to one house. People can still socialize outside of their house, but like anywhere else that we go in public, those are the times when we want to start seeing, we're going to be wearing our masks if we're within 6 feet of each other. And we want to be keeping our distance if we're hanging out on the lawn between households. But if you can use those units, it's going to simplify things for your contact tracing if there is any sort of positive case amongst your crew. And it's going to make it a little bit easier not to have your entire crew sidelined if you're using some of those units. It's very important to give workers good information in ways that they can understand. So sometimes that's a language barrier, sometimes that's a literacy barrier, sometimes it's just having someone who's culturally attuned to wherever your workers are coming from. And that's another thing that the Maine Mobile Health Program can help with. They have fluent speakers in Haitian Creole and Spanish and English, obviously. And they have a bunch of materials that can help give that basic health education information so that your workers are part of the solutions for what you're trying to do, not just something that you're trying to control around. And the more that you can equip people with information, just like the rest of us, the better we can be about protecting our own health. And then lastly, the other key point that we really you'll hear us emphasize a lot, is that things will happen quickly and need to happen quickly if people are sick. So if there's symptoms or there's a positive test result for COVID-19, we need to be moving really quickly to get that person isolated, not totally alone, right? We need them to have food, and they need to have access to medical supervision daily after that point. But we need to get them care, and we need to get them out of the shared housing and the shared transport and the shared work pretty immediately. And then we also need to be working to identify whoever they've been in close contact with, whether that's on a household level or that's people that they were working with. Okay, so there's a couple of really immediate phone calls that are going to have to happen. So one's going to be the CDC, one's probably going to be Lisa, one's probably going to be OSHA, and then all of those people are going to help you figure out what you need to do at that point to manage the rest of your response. So I'll pause there real quick. Those are the high level points of just the key interventions that we've pulled out in Maine. These are the practical interventions that are the most crucial. Lisa has dropped her contact information in the chat box to everyone, so you should have that available. We've also plastered it kind of everywhere throughout all of this guidance. And if anybody needs it, reach out to anybody involved with farm work and the COVID-19 response. So do we have any questions right now before I zoom into the next part? Okay. So I jumped through, we've got links to the CDC guidance here. We've got links to the long Maine guidance that has a whole bunch of things to think about. We've got links to that short fact sheet that I was just going through. Those are all in the email that we sent around as well, advertising this event. We've just talked through, these are our key interventions. One that I kind of moved a little quickly over that's really important is doing daily health screenings. We're going to talk about that a little bit more in our practical information. So when we get into our practical information, this is all coming from the real ground truthing that we've been doing this season as we've been getting out into the field. And by we, I mostly mean Lisa and the department and other state parties trying to help coordinate how do we respond to what's going on. So important things about screening and testing. It is available for all migrant and seasonal farm workers. You don't have to be a migrant worker to be able to access testing. That's in some of the executive orders. And it's also something that is accessible for free for farm workers, even if they don't have insurance or are not documented. So that's important for everyone to know. That should not be a barrier to getting testing. If farm workers need testing, then we want to make that happen. As Lisa rightly points out in the chat, it's also available to farm employees who are not migrant or seasonal. So for those of you who may not have migrant or seasonal workers coming from other places, this could apply to your farm workers as well to access that testing. So for those of you who may know people who aren't on the call today, feel free to share that news as well, because I know all of us are trying to manage this, particularly in Apples, where we know we may have a lot of visitors coming and we may be concerned about that. So that should be available to you guys as well. We talked about testing within 72 hours of arrival if we can. The Maine Mobile Health Program uses the rapid test that gets you results within 20 to 30 minutes. So that can mean that you may have to act really quickly if there's a positive result. So you want to be pre-gaming a little bit of your plans ahead of time, and that's something that Lisa's crew can help with. They've done a lot of talking to growers before the workers arrive, even to help some of those what ifs, to help those operational, like, this is my setup, what do I do with it? Do some of your homework, but they can help brainstorm with that to figure out what can we do with what we've got, and then what's our backup plan if things start to go awry. We want to mention that you should expect to retest. So even if you have negative test results, what we're seeing so far is that the state is wanting to see more tests after that. And that's not because the tests are unreliable. It's partly because of the stage of incubation and infection that you're at is what will make that test show up as positive or negative sometimes. So it's not the test itself, it's about matching the stage that we're at in disease progression with the test that we're using. So expect to have yeah, go ahead.
I just want to, sorry to interrupt. I just want to say a word about retesting. What we've seen right now for retesting is that there has been, the state has asked for more retesting in locations where there are positive cases and not as much where we have done tests and nobody's tested positive. It doesn't mean that guidance that they release won't be focused on places where everybody's negative, but right now we've been kind of focused on places where there are a few cases.
Thanks. Yeah, that's great context. I think you want to be going into your season knowing that there may be a reason to go back and test again. And that really comes into play with some of your screening strategy. So we'll talk about screening as well. Let me get back into what I got going on here. Okay, so when we talk about screening, there's a couple types of screening that we're talking about. So one is the daily symptom screening that you're probably already familiar with. We want to take the temperature. We want to ask people if they've been exposed to anybody who is positive or has been come back from outside the quarantine bubble. We want to be asking people, do they have a cough, difficulty breathing, shortness of breath, the COVID toe, any of these enormous list of symptoms. But that daily screening is something that growers want to be doing for all workers who test negative as well. We don't get a negative test and think, oh, we're done, like we're all good. A test is a moment in time. And these daily symptom screenings are really, really important because they've turned up positive cases in people who had previously tested negative. And Lisa, if you want to jump in and talk a little bit about that, this would be a great time.
Sure. Thanks. I think that we are not sure how much people are screening on a daily basis, workers, but as Leah said, we have definitely had growers call us and say, I have a worker who's got 100.4 temperature. We've gone in right then and there and tested them and they've been positive. And that was not what we expected after getting a few negative tests. So that intelligence on the ground comes from your crew boss or from your staff that are taking temperatures. It's important to do more than just take the temperature. You really want to do a little screening of symptoms and see if things have changed. And if anybody is short of breath, it's really, really especially important that you immediately contact 911 or us or a medical professional to help you figure out what to do in that situation. The shortness of breath symptom is a really, really important one when it comes to COVID because that can precede things that are not good.
Yeah, and of concern is our last bullet point there, that this disease can progress so quickly. It can go from someone being a little bit short of breath to needing that critical care or they're not going to make it. So that's something that we're not trying to be scaremongers, but we're trying to help everybody understand, when do I need to act quickly? right? Because there are a few times when we need to act very immediately and very quickly. So if in doubt and there's any of that shortness of breath or difficulty breathing going on, we pick up a phone to the medical professionals at that point. We don't just try and tough it out. Okay, like I know all of us in the farming sector have a tendency to kind of just tough things out, but that's not the time for it.
And further to that, Leah, I just want to say that for farm workers who need to be transported by ambulance, we are paying for that service this year. So don't let an ambulance bill make you, don't make sure your workers know that that service is covered, and emergency room services are covered by our program if workers don't have insurance.
Thank you. That's very important. So that wraps a little bit of the daily screening that growers should be doing with the workers. But we also want to talk about workers who are positive, or they might be, they've been quarantined because they've been exposed for whatever reason. They need to be monitored daily by medical professionals. So this is not me, the grower, I'm checking on the people in their room by themselves and being like, well, they seem about the same. You need to have the outside medical professionals doing that ongoing care and supervision for anybody who is positive or who might be. And part of the reason for that, again, is that the progression of symptoms can be really fast, but also because there may be other conditions that a worker has where they might need other medications, they might have something that they may not have shared before, and that's really important for them to have that confidentiality with their medical professional, but also to have that professional able to give advice and care and give whatever they need at that point for what might be several interacting conditions going on. So that's just something you're going to hear emphasized a couple of different points. When we talk about screenings, there's two different types of screenings that we're talking about.
Yeah, I also want to say that if you are with your workers and they have a health concern, it's likely that you'll have in your camp a flyer with one of our community health workers' numbers on it. But if you don't have that access to that information, please feel free to reach out to me, and I'll get you connected with the community health worker and medical professionals that can help your folks get access to medications or care for whatever ails them as they're arriving or while they're here.
Okay, so talking a little bit about housing, this has been like a big question mark for a lot of folks. So we've talked already about how having your household pods as a working unit or a traveling unit, if you're going between fields and houses, is a good control strategy if we're trying to control the spread. And when we look across the country, part of what we're seeing a lot of in farm worker outbreaks is that once one person gets it and is symptomatic and gets tested for it, we're finding everyone on the crew is positive, or it may be 175 out of 223 total workers. It's a really incredible amount of spread. So what we can do to try and make those pods is going to help us to have a stop break if there is going to be some sort of spread going on within the overall group. Once we start to get positive test results, or there are people who have been exposed, they need to be housed separately from other workers, and they need to be under that medical supervision like we talked about. So make plans now as best you can. Think about where do you have room on farm, not just to put someone in the corner of a bunkhouse, but can they have their own room? Can they have their access to a bathroom that's not shared? Things like that. And if you are coming up against a wall in that respect, that's where you want to be talking to Lisa, and you want to be talking to the state about that. We've worked some partnership. Stephen, I don't know if you want to talk about this or not, but we have worked when the wild blueberry harvest workers were incoming. We worked to try to arrange some overflow lodgings so that we could get people into safe situation and be under medical care. But overflow lodgings can fill up really quickly if there's an outbreak and if there's spread and if it's industry wide. So that's something that if there's anyone else who wants to chime in on this who was involved in our recent rounds of this, feel free. Or not.
Leah, can I say one thing about isolation and quarantine? Stephen, sorry, I'm constantly cutting Stephen off in other calls. I just want to say that there is, and maybe we're going to go through lessons learned in a minute, but I think we tend to use isolation and quarantine interchangeably when we think about COVID. Isolation is a situation where a person is positive for COVID, and person who's positive for COVID needs to be away from anybody else who doesn't have COVID. A person who is in quarantine is a close contact of a person who has COVID. And one of the things to keep in mind when you're doing your testing or you're having your testing done, and I'll say more about this later, is that it can be very confusing to workers when they test negative, but the people they drove up with or the people they were in a bus with tested positive, and suddenly everybody is going into quarantine. And their quarantine is maybe explained to them as being 2 weeks. But if during the period of their quarantine, they then are tested and are revealed to be positive for COVID, their quarantine may go beyond 2 weeks. And so I don't want to derail this part of the conversation, but it's really important. And we've learned a lot about how to communicate with the grower and with workers about all the different things that can potentially happen when you get tested, and that your own status as COVID positive or COVID negative is not the only consideration.
Mm-hmm. Yeah, so we're going to talk a little bit more about this in a minute, just about how this plays out once we start getting test results. Stephen, I don't know if you wanted to jump in and talk about housing at all, or?
I'm happy to just briefly, Maine Housing, in partnership with the Department of Health and Human Services and a variety of other partners throughout the state that are social service providers, have set up locations where individuals can receive, have safe isolation or quarantine, if we're being mindful of language again, throughout the state, that can be utilized if individuals meet specific criteria after being referred by the Department of Health and Human Services. And Sharon McDonald is also on the call, and she may want to give a plug for the contact information, because as many times as I've seen the email address, I only remember bits and pieces of it.
Yeah, Sharon, if you want to chime in, feel free, or if you want to drop your contact information in the chat box, also great.
Sure, and we're just, I will write it down. I have to pay attention though every time I do it, but it's dhhs.covidsocialsupport@maine.gov, and I'll put it in the chat, but I can't do it at the same time that I'm doing something else. We do, we centralize the referral for social supports, and so we work closely with Lisa, Stephen, and other players, because managing large groups of folks or even small groups in rural areas is complicated. And so we will try to centralize through our email address, and then quickly within 4 hours, be sure that somebody is on the case for social services, housing, cultural brokering, interpretation, whatever. And that's all done through the central service. But yeah.
Great, thank you.
I also want to say, Leah, just, you know, the way we've done this so far is if there's a testing event and somebody tests positive, we'll get a consent from that person about whether they are willing or not to be referred to social services, so that we can provide that information directly to Sharon and to many of the folks that you see here. We have a Catholic Charities, a CAP agency individual here, and we have a call every morning where we talk about what happened the night before. And so you can definitely contact that email address, but it's also a process that we've worked on so that your folks, if they're positive and need care, will be referred kind of automatically into this system.
And we do not share it with, I mean, this information stays here. We do not ask about immigration. We're not limited for people that are not documented, but we don't ask about it, and we do not share that kind of information. That's one of the concerns that people often have.
Yeah, that's great to be upfront about. Okay, so we can circle back to this part too if people have questions about this later, but I just want to let everybody know that we're trying to work to make some of these options available, so that if you're really in a bind on the farm in terms of what you can provide for safe housing for people who need to be isolated or quarantined, that there are some options to explore so nobody's back is against the wall. So if in doubt, pick a phone and someone will figure out who the person is who can help you. Okay, so everybody's kind of on deck to help out here. Let's, okay. So when we talk about transporting sick workers, this is something that has come up more recently from what we've been learning in the field. Workers may need immediate transportation in several situations. So if they test positive and they need care or they need separate lodgings, if they've been exposed and they need to quarantine separately, or if they have symptoms that are progressing rapidly into respiratory distress, or if they have some acute need to get medical care. In that instance, it's important to think about the driver at that point who would be transporting these workers should be fit tested for an N95 mask. And this is something that some folks are trying to work on providing that fit testing, but be thinking about, are there people on your crew who have been fit tested already? If not, let's try and figure out how to get them fit tested. As Lisa was saying, there are options for people who are providing transportation. So Maine Mobile Health Program should be one of your rapid response calls. And if in doubt, don't be afraid to call the ambulance. Since, as Lisa's saying, there's ways to cover some of those costs. The important thing in those situations is we need to act quickly to limit the spread, but also to get folks their medical care. So if there's anything else to chime in on, feel free, Lisa. Otherwise, I'll keep rolling.
Yeah, I'll just say that if you call our main number, which I'll put in the chat also, we have a 24-hour line. Often if you're calling in the middle of the night, the nurse triage will ask you to call 911, but there is going to be somebody to answer 24 hours a day in Spanish, Haitian Creole, or English, and I'll put that overall number in.
Okay, so then when we start talking about our isolations versus our quarantines, as Lisa was saying, positive cases need to be isolated. That's a medical public health term. Quarantine is what we do with people who have been exposed and might be positive, partly while we're playing a waiting game, partly so that we're not contributing to more spread if we don't have to. So a couple of things to think about there. Like we talked about before, if a worker's tested positive and needs to be isolated, they need to be away from other workers. They need to be by themselves with proper medical supervision and getting whatever essentials they need for their nutrition, for their medication, for whatever else. And then people who may have been exposed might need to be quarantined while they're waiting for test results or the negative symptom screen. They should not be in shared housing either. You may have a situation where there's groups of asymptomatic workers who may be able to keep working together as a group as long as they don't show symptoms, but that's something that response is going to be directed by the medical professionals, by CDC. There's going to be a lot of folks involved in your life if you've got some positive tests going on and then there's asymptomatic workers that you're trying to see, well, can we keep going? That has been an option in some cases. And again, we're continuing to stress this point. Any worker who's isolated or quarantined needs to be monitored under that outside medical supervision. Lisa, I'm gonna let you jump in.
Yeah, I'll just say that this definitely has happened in practice where we've had a group of folks that came up from together in a big group. One person tested positive. The rest were quarantined on the work site and continued to work during the day and come back into their quarantine housing at night and work like a regular crew, but they're just not going into town, and the grower is providing them with food, and they're staying put, and that seems to work in some situations. You'll get advice about this from Maine CDC as well about what they see. They'll if you have positive cases, you'll have a conversation with an epidemiologist, and they'll talk to you about your setting and whether it's feasible for you to have folks working who are close contacts. But we'll work with you on that as well. It's, there's a lot of questions that get asked and a lot of judgment calls that end up getting made, but it's worked successfully to have folks working after they've been exposed.
Mm-hmm. And, the majority of cases, people survive just fine from COVID, but our urgency and concern here, again, is that it can progress so rapidly. And when people have severe complications, it can be really horrifying. And so we're very motivated to try to prevent that and to try to control some of those conditions of spread. That's why we're really stressing to act quickly. Ideally, this is what we would be doing at a population level, to be able to identify cases, isolate them, and contact trace to enable operations to keep going. And we'll talk a little bit about that in the lessons learned. When we talk about return to work, so workers who have been exposed or quarantined because we don't, they were in contact with someone who was positive, but we don't know if they are, they can return to work after a negative test. We talk about retesting might be likely in their future, depending on what you're directed to do by the epidemiologist. And symptom screening, again, is always advised, whether it's your daily grower screenings for people who are negative, or it's that outside medical professional for people who are positive or presumed positive. Lisa talked a little bit about, let's say you have people who are quarantined because of an initial positive case, and they're going along and they're asymptomatic, and so far they've been negative. Now someone else in that quarantine group tests positive, they may need to quarantine again. So this can end up compounding like a little bit of a train, like train cars attached together. And that's situationally dependent, but just be aware that that may be the case depending on what's going on. Workers who test positive can return to work after 10 days have passed, after symptoms have started, and 3 days have passed without a fever, without using fever-reducing medication, and other symptoms are all greatly improved. So there's a combination of things that need to happen there for someone who's positive to return to work. And Lisa, is there anything else you want to say on this part of it?
I'll just say that this can also be confusing because positive individuals isolate for 10 days. Their friends who didn't test positive quarantine for 14 days and potentially get retested after 7 to see if they've become positive, but usually do get retested after 14 days. And there's been a lot of confusion about why that difference in timing. So we want to be really clear about that from the start. From right when somebody is told that they need to quarantine, that their quarantine period is going to be different than the person who's positive, and they're going to be kept separate, quite separate from the person who's positive on a separate floor, ideally, separate room.
Correct me if I'm wrong, but the logic to remember there is by the time someone is showing symptoms, they've been through an incubation period and possibly several days of infection already before those symptoms manifest. And that's part of the reason why you have 10 days after symptoms for someone who is positive versus 14 days for someone who may just have been exposed. Those 14 days for that quarantine of someone who may have been exposed is because the incubation period can be up to 14 days. By 14 days, 95% of people who are going to be sick will show up sick. That's where the 14 days comes from. And then those 10 days after symptoms start is taking into account, well, once we have that incubation period and the onset of infection and then seeing it play out, now we're adding up to our 10 days there after all of that. So it may seem a little counterintuitive, but that's something that Maine Mobile Health Program has been learning in the field and figuring out how they want to communicate with folks about that. All right, so we're going to jump into.
Can I add one thing?
Yeah, go for it.
The conversations that Lisa, the epidemiologists, and the cultural brokers, interpreters have to have are really complicated. I just want to echo the fact that you'll have an anticipated in quarantine or isolation date that is never complete until they go through that last day, and it drives people mad, understandably.
Right.
That's what everybody has to struggle with, because the reality is that there's no certainty until they've gone through the last kind of either the test or the symptom check or the time frame.
Mm-hmm. And that goes back to making sure that the workers themselves get good information in a way they can understand. And so having those cultural brokers, having those linguistic access for people who speak their own language, whether it's someone within the crew or someone at Maine Mobile Health Program, or whether you're being connected to it through DHHS, whatever that is so important, because if someone's stuck in quarantine after quarantine and doesn't understand all of these things, it's plenty for all of us to jump through in our native language, then we're not helping anybody unless we're getting them that information so they understand what's going on. And I think as we've all watched the news cycle, doesn't matter where you are on any kind of spectrum, I think what we see is that we have to be really realistic about what behaviors are, right? And so people make decisions about behavior based on what they understand and based on how they understand the consequences of that action playing out. So you'll see that in the next slide, is be realistic. But we want to share just a couple of high points of what we have been learning as a whole group of collaborators on this from the response to the wild blueberry harvest workers, as well as some of the earlier incoming workers.
Leah?
Yeah.
Leah, this is Dawn. I just realized, are you showing slides? Because we're still on the 2-page document.
Oh no, yeah, I was sharing slides the whole time.
Oh,
Dang, dagnabbit.
sorry. Because you were
Oh, that's
talking about
okay.
the things that were on the screen, and I thought, well, that's
Well, strike another one for technology.
okay.
So much for that. Can you see that now?
Yes, now we can.
All right, well, take that one on my chin. Okay, so lessons learned from wild blueberry harvest and other sets of incoming worker. We talked about a lot of these already, but screening and testing is really critical to minimize the spread of COVID-19, but also to minimize the disruption to operations. We've seen several examples of this where we had lots of incoming workers, did that testing and screening, and it didn't shut down the whole operation, even as there started to be positive cases, even as those positive cases increased. And part of the reason that they were able to continue operations in a way that was not like a drastically negative impact on their business, I mean, you may hear differently from them, but relatively speaking, we didn't have the entire crew sidelined and shut down, 40% of a harvest, because you were able to identify, isolate, contact trace so that they could start moving groups of workers back into the workforce. Okay, so again, we really stress that screening and testing. Lisa talked about how the screening has turned up cases even after multiple negative tests. That's not because the tests don't work. Again, that's because of the stage of the progression of incubation and infection. Your tests are going to be effective for certain stages of the disease. Okay, so doing that daily screening can catch something after that moment in time when you did that test. So we really recommend that. What we have seen, we all know that COVID-19 is highly contagious, but I would just remind everybody that it doesn't only affect the workers in the camp. What we have seen as we step very carefully with our discretion responsibilities here is that we've seen that it also affects workers who are not just in the field role, not just in the manual labor roles, not just incoming workers from migrant or seasonal worker pools. It's affecting workers in any part of the organization if they have contact with somebody who's positive. So that's where we just want to remind you that you yourself could be at risk here. And it's not an inherent risk of the incoming workers. It's more about if you have positive cases that are undetected, it's the same as in any population. You're working in close contact. You may be in situations where you're not able to wear your mask, that you yourself or your family or your local workers, anybody who's working together could be affected by this. And as we all know as well, when we're going into the grocery store, we're going into Walmart or wherever else, like nobody wants to keep a worker prisoner, and we shouldn't, that's just wrong. But our communities can be affected as well. So again, stepping carefully about discretion here, but it is important to know that this is not only a conversation about people in the camps, right? This is a conversation about anybody in our operation and in our surrounding communities as well. We've talked about how COVID-19 can progress very rapidly. That's something that we've heard about nationwide, but I have to tell you, hearing about cases here in Maine that are anecdotal are a lot scarier. The same information is closer to home. And so that acting swiftly if somebody has the respiratory distress, that's real. These are real cases that we have seen in Maine at this point. And so that's something to think about. Whatever your worker housing situation is, do they have access to communication? Do they have a number to call? Do they have phones? If something happens in the middle of the night, how is that playing out for you on your farm? Okay, and that may be something that you've already figured out, but it is something to make sure that if something happens in the off hours, we can act really quickly, because we can't afford to wait overnight. And sometimes we can't even afford to wait 3 or 4 hours. Sometimes it progresses that quickly. And I'm saying all this so that nobody else has to worry about stepping around confidentiality stuff. Like, we're trying to be careful about what we're sharing here, but that is something that we've seen in real life at this point. So it's really important to understand that that can move really quickly when we have severe complications. So while the majority of people are not going to have the severe complications, it's something we really need to be aware of. So we talked a lot about how fast action is important to isolate cases, and contact tracing is really important. That's kept most of the incoming workers working so far. And Lisa, I don't know if you want to share generally about this. Feel free to not, if you feel like you shouldn't.
No, I mean, I think what you've heard in the media has been true, that there have been, today Dr. Shutt talked about 31 cases, positive cases in the blueberry industry, and those were all captured due to proactive universal testing. And I think we feel pretty positive about that. The other thing I would just say is that when I guess I just want to sort of say that I'm happy to talk to any of you who are going to have testing and go through the sort of scenario that you can expect, and we can talk about the different options. I have spent probably most of my time over the past 3 weeks talking to company owners who have questions, and it's been really helpful for us to kind of get to know each other and to figure out exactly how this is going to work when we come on site and do your testing. And I'm happy to answer any questions, you know, at that time too. I don't think I really answered your question, but I guess what I want to say is, if you're committed to doing testing of incoming workers, you will spend time talking to me, and we will spend time together after the testing is over, unless everybody's immediately negative, which would be great. But
Which happened a couple of times.
yeah, certainly it's happened. But it will take some involvement of you, and you know, just want people to be prepared for that this takes a bit of work to get through.
And Lisa, for perspective, are you able to share, let's say, a total number of workers in the blueberry sector that were tested? Can you share the aggregate number? You're on mute.
I don't really feel very comfortable doing
Okay.
that, but I can say that the percentage of positive cases that we identified was quite low.
Yeah. So that's what I'm driving at, is that,
Yeah.
you know, for the incoming blueberry workers, you're talking hundreds and hundreds of workers, and you have 31 cases that we were able to find, instead of hundreds and hundreds of workers 3 or 4 weeks after everybody arrives. So I'm going to keep preaching this gospel a little bit, but everything that we can do to quarantine, test, isolate, contact trace, and act quickly is going to help us minimize how many people are affected, but also what's happening to your operations, and what we know is a relatively short harvest. Okay, the other thing that we've seen, and this is, you know, a little subjective here, but the conditions and spread can be very different between like a stationary washing packing type line and field work where workers can socially distance. So this is more anecdata, and we probably can't say too much more about it. But I would say that, you know, as we're trying to eyeball what our relative risk is for our workers, thinking about what kind of work are we having them do? Are they out in the apple orchards where they are able to stay distant? Can they just be mindful about when they're, you know, dumping the baskets into the totes kind of thing? Where are those points where we need to think about concentration? A lot of what we've dealt with in the blueberry sector, from every facet of helping people try and respond to this and prepare for this, is, well, we have processing lines, you know, where people have to stand side by side. There are other crops in the state of Maine where to harvest, you have to be side by side. And there's a difference in what our controls are in some of those contexts. So think a little bit about that, and we can talk about some of that in the discussion. Oh yeah, great. Thank you for Catholic Charities chiming in. There's some great resources there in the chat, so take a look at that. You heard me say before, it's important to be realistic about what conditions are on your farm and your housing and your transport, and what behaviors are. What are people actually doing? So I'm not going to sit here and look you in a Zoom screen and tell you that your worker should make them wear a mask while they're riding in a van, working all day, and then in the house, right? Like, obviously that is what you would see in all the different pieces of guidance, but we need to be realistic. If people are not going to wear a mask in the house that they're in, right, then that's not what we're going to focus on. If the working conditions in the field are too strenuous and hot to safely wear a mask without heat exhaustion, then we need to be realistic about that, okay? If we need people to wash their hands, but we're not providing them break time, we need to be realistic about the choices that we're making, as well as what we're expecting people to do. So I don't think we can bury our head in the sand about this. It's much better to have a conversation with anybody who's on the line about what reality is, so that we can work from there and try to find our best outcome. Okay. And like, I'm not going to judge you. I'm going to try to help you like get to whatever next step we can, knowing that there are best practices and there are standards of care that various people in various roles have to mind, but please be realistic. Overall, the cases have been lower than we maybe feared or expected. From reading about this across the country, again, like I was telling you, where you have one symptomatic worker, oftentimes you're finding the entire crew is positive. And so far, it seems like some of the strategies that we've been able to deploy, the proactive work that the business owners have been taking, that direct contact with Lisa's crew, what the partnerships to be able to get people into housing where they can safely isolate or quarantine, all of that has been fairly effective. So that's really encouraging. And I'm pretty hopeful that Maine might be able to be a success story on this one. If we can keep just trying to put pedal to the metal and work together on this and just like try to respond in what we know is the right way to do it, we might be able to continue this trend and keep those cases fairly low, relatively speaking. So far, this is really early, but this may be germane to our apple industry. So far, there haven't been that many cases and workers coming in from the Caribbean countries to Maine. I don't know about the rest of the US, but what we've seen in Maine for the different groups that are already here from the Caribbean countries, haven't seen too many cases. I'm not going to say more about that because I don't really have more information about that, and Lisa may not be able to say more about that, but just that's a little bit of encouragement, so we can keep our fingers crossed on that, particularly where we know we've got a lot of Jamaican folks who are coming for our apple harvest. Part of that, it's not really profiling a region so much as the response of a lot of the countries in the Caribbean was to shut down travel pretty early. So that's more of the response possibly driving some of what we're seeing. Lisa, you're unmuted.
Leah, I just want to say that what I think we are seeing is cases amongst individuals who are traveling to a lot of different places, like farm workers typically do in the US, and doing migrant farm work in multiple locations. So if somebody's coming from Florida to New Jersey and then going back to Florida and then coming to New Jersey and then coming to Maine, I think that's obviously a riskier situation than somebody coming directly from a low prevalence country on a plane and then coming up on a bus. What I would encourage anybody to do who has any control over how your folks are arriving is to separate them out in as many small buses as possible. Even being in a bus separated, with empty seats and empty rows is going to be tricky if somebody's in a bus for 6 hours with other people who might end up testing positive. So as much as possible, if you can ask the folks who are helping you with get your crews in to bring them in a smaller number of vehicles. As Leah said, that kind of podding or sort of separation is really important when people arrive and get tested.
Mm-hmm. And then we've talked about this before, but timely communication with medical providers is really important. So where we've been able to have that success and do actual real intervention when people are deteriorating really quickly, that's happened because there is that timely communication. And that can be before the season, during the season, in the middle of the night, whatever it is. But make sure we figure out who's on speed dial. So if we need it, we can be in contact really quickly. And hint, it might be Lisa. Okay, I'm mindful of the time. We're almost coming up on the 7 o'clock. I'm willing to stay on and have more conversation, but I know the big elephant in the room that we want to talk about and don't necessarily have great answers for is about replacement workers. So if we do have our whole workforce sidelined, if I've got 6 to 10 folks and they're all in the same house and I have to quarantine them together, how does that work if I can't put them to work? So from what we have heard from some of our state monitor advocates, the H-2A has a substitution process. So you would contact your agent who processed your original request tell them what's going on and that you need replacement workers. They would file a request for substitution workers. They said not to file anything directly with the Office of Foreign Labor Certification because that can essentially start you from the beginning. But the time frame to get substitute workers is fairly unclear at this point. I don't know that it's been put into play in Maine yet, and I don't know that anybody knows how long it would take to get replacement workers. So that leaves us looking at more local options. The Maine Farm Labor Link may have some resources there. They're trying to do some promotion and matchmaking for Maine farms who need labor and workers who are looking for it. You may be able to find people through local temping agencies, although we know that might also be challenging given just the different economic scenarios that are going on. And I want to mention mutual aid and ag service providers. So the last time we had this call, representatives of different ag service providers like Mofga and others have said, hey, you know, if you're in a jam for workers, let's not assume that there aren't people who would come help you out. Let's put the word out, put the call out amongst Maine Farmland Trust, like all of these folks who are involved in the ag sector, and see, do we have people who can step up, who might be able to mobilize and come to where you are to help you get your harvest in. So again, don't despair. Make some phone calls or emails to anybody involved, and we will all try and see what we can do to help out. So I know that's not the satisfying, like, here's the magic 1, 2, 3 of how we replace workers if they get sidelined. But it's a couple of options, and it's the information that we have right now. And I just wanted to make sure that we're naming the elephant. So I'm gonna stop talking there and see what you folks wanna maybe get into at that point. I know this has been a full hour of me speed talking with the wrong screen shared. But what we want to hear from you guys is we want to hear about what are the concerns and the questions as we're going into apple harvest or other crops and having incoming workers, and what do we need to game plan together, because we're here to do that with you.
Hi, this is Heidi. I work for a CAP agency and so have been just peripherally involved, but I would certainly want farmers and folks to really understand the importance of transportation in this process around getting people to safe places and getting them back from safe places to the farm so that they can work. That has been probably the biggest obstacle that we have struggled most to overcome with our first experiences in this work.
Yeah, I want to second that as well, that, and it gets complicated. I think Lisa has alluded to this, because you won't put a contact maybe in the same car with a case, and you need to be sure your driver is okay. And there's a lot of, you know, connecting the dots here that is complicated, and we really need everyone to be able to sort of chip in, and sometimes we'll reach out to try to make sure that folks can get where they need to be, particularly if they feel like these are people that don't need to be out by them, you know, far away out of cell phone service and that kind of thing. The main thing is really, if you know you have housing for them, because they can, if they're contacts, they can keep working if they're nearby. But if we have to put them in Bangor or Lewiston or wherever, then they're not near enough to be able to continue to work as contacts.
I just want to speak on the using of hotels as a resource should individuals need isolation and quarantine. And I think there's something that we learned really strongly is that it's a really preferred method for the farmers and the growers in instances. And what we failed to neglect is to make it an option of choice for the individuals that would need to use them. And it was often framed as a, you need to go here now. And I think reframing that in the conversations that you're having with your employees as to, this is a place where you can go and here are the resources that you will receive if the individual is approved for housing through the social services. But I think that's a really important takeaway that we learned, that it feels, having it as a solution feels really good, and it is good, and that's why we've set these resources up. but making sure that the individual who will need to use the resource also feels like it's a resource and not like they're going to jail or being taken away from their work and from the individuals they know is really important. So from a person, making sure that they understand how beneficial it can be if they're approved for it as well.
And I think for folks who are in the state to work, to earn money, to perform a duty, to be housed in a place that absolutely prevents them from doing that, particularly if they're just contacts and can safely continue to work in cohorts and be monitored. I think it's more difficult even for those folks to understand why they're there and to just be so far that it limits their options.
Do we know yet in Aroostook County for sure where such a place would be, specifically in the Presque Isle area? Has that been decided?
Dorothy, are you asking me?
Whomever can answer it.
We are in the process of contracting with a social service provider and a hotel. So that has been identified, and we are finalizing both of those contracts.
Okay, thank you.
Absolutely.
One of the things I'll say about quarantining and isolating individuals on site is that they need a medical professional to come and check on them once a day. And it isn't a member of the farm staff. It has to be somebody from a nurse or a medical assistant or a health coach. And so that's more complex if somebody is quarantining on a farm. And we'll work with you to try to put that together. But that is that, and whether or not your workers have access to telephones on site and whether there's access to emergency services are some of the decisions that go into whether the Maine Centers for Disease Control recommend that somebody stay on site or move into a different environment. So those are all considerations.
Something that is helpful, if you know you have incoming workers and you're going to be doing some of this working with medical health providers, letting them know when you're expecting the arrival would be really, really helpful to them. So if you know when you're scheduled to have your workers coming in, whether it's Lisa or another group, let them know that so that they can plan accordingly. As you guys can imagine, we're all pretty busy this time of year. And so trying to manage the logistics of making sure that resources are available where they need to be, and we can pivot where we need to, that kind of thing is really helpful. So we've been trying to do a little bit of asking those questions and finding out, what kind of numbers do we have coming in where, and treating that information responsibly, of course, in terms of being confidential and discreet about it, but so we can plan where do we need to have capacity for overflow lodgings, or where do we need to have capacity for manpower to have people doing screenings, that kind of thing.
Hi, everyone. This is Charles from Catholic Charities. I think one thing I'd really like to mention is regarding the paid sick leave. I really think that, if folks get that information, towards the beginning of the quarantine, that sort of brings peace to the isolation and quarantine itself. Otherwise, folks get, they start panicking in the middle of the quarantine. Well, am I going to get paid? I have a lot of bills, or my families are relying on me to send the money right after the release. So if we could have, if the employer could be able to provide that information in the beginning, or at least in case of issues or stuff like that, it could be worked earlier with Department of Labor, see if there could be a substitute through the pandemic unemployment assistance, so that folks can at least get some sort of financial assistance during or after their quarantine. Thank you.
Yeah, thank you for that, Charles. I think it's really important, as you guys likely know, to be clear about the pay situation, because we can remove a lot of barriers to doing the right thing for health if we answer some of those questions before the question is asked, right? So if we as the employer are upfront about, here's what happens, right? Like if this happens, here's what happens in terms of pay, here's what happens in terms of, you know, if you have to be isolated, who's paying for food, who's paying for the room, like these kinds of things. And if we take away some of those question marks, then we can get a lot more peace, as Charles was saying, and willingness to go along with what is the right thing, both for the worker and for the coworkers as well. And I continue to stress, I don't think there's any way out of this pandemic without paying attention to what's doing right action by other people. And so in this case, we know that there may be language and cultural brokering or communication that needs to happen, but there's also a transparency aspect that we can just be upfront about things, and we don't have to have all of the answers, but if we share what we know and we get some of that information from people who do know, then we can probably have a better outcome for all of us.
And a reminder to the person on the phone, if you'd like to speak, you can hit the *6. Looks like they're all set. Any other questions?
Okay, well, if we're feeling good for tonight, I guess what we do usually with the chats is we'll take the links and the information and we'll try and make sure we capture that. It'll take a little bit to get the video processed and then get it up on the Cooperative Extension's YouTube. They're awesome about doing that. But in the meantime, I guess like the thing I really want to reinforce for everybody is, if in doubt, pick up the phone and raise the bat signal to any one of us. There's a lot of collaborators working in the space right now, and any of us are going to reach out to say, you know, do you need Charles to do that cultural interpretation? Do you need Lisa to come do testing? Do we need to be talking to Stephen about housing? Like, we will figure out the person that you need and get them to you in a timely manner. So even if you don't have everybody's contact, reach out to whoever you've got, and we'll try to get connected to get you what you need. So that's my big punchline for tonight. Call the bat phone.